first of all, let me assure all healthcare providers in the room and LSU that I absolutely 100% support and understand the concept of a state-of-the-art flagship teaching university hospital. That's a no-brainer. Very comfortable with that point. The question is the best way to go about that, and the question is, for the amount of money that's being spent to build a new facility however many blocks away, I am told repeatedly by contractors, I understand they're not healthcare providers, that for that amount of money you can gut an existing building that could never be reproduced as far as integrity of the structure, have the same state-of-the-art system, have a better built outside structure for less than the money that's being spent on the proposed new structure. Do you have any comments on that?
Well, again, based on experience, the typical process you go through when you're deciding whether to build a new hospital or renovate an existing hospital is to do that very analysis, is to have somebody come in and the cost. First of all, I mean, if you're talking about the old Charity building, I mean, you have to determine if there's mold issues. There's a lot of issues you got to deal with. I'm quite certain electrical issues are abundant. You probably have to start from scratch.
We're talking gutting.
Yeah, so,
totally.
So I mean, I think typically, again, having done this multitudes of times, the starting point is what is the cost of renovating versus building new? I can't tell you if that analysis has ever been done or not, and I can't tell you. Typically, that is done. Then from that point, if the decision's made, I will tell you, the cost, and I'm using gross numbers that I've looked at on large. We're talking about a $1 to $1.2 billion project for, let's assume it's 400 beds. Okay, if you do the math, that's about $2.5 million a bed. I'm not aware of any hospital, I'm not saying they haven't been done, I'm not aware of any hospital that's built for $2.5 million a bed.
You're saying that's high or low?
That's very high. The average is about $1 million to $1.2 million, and it depends on where you're building. I know of hospital projects right now that are being built, 250-bed hospital plus 2 medical office buildings for $1 million a bed. The total project cost is $250 million. I'm not saying, but you're talking about a teaching hospital. There's going to be some soft space. So let's say $1.5 million to me seems more along the lines. But I don't know, again, this gets back to the business case I keep talking about. This all has to be part of the business case. $2.5 million a bed is a very high number, and I would suspect if you compare that, it's...
When you say we'll get back to the business case, I'm going to ask you about that, but here's my concern. You would think that that analysis would have been done, and someone's probably going to get up later and say, oh yes it was, we have it right here. But if it was done, my concern is it was done on the back end as justification, because I was there, as everyone at this table was there during Katrina, when Charity was, quote, closed. And I'm sure these fellow senators heard just what I was hearing from the ER doctors on the inside saying there is no reason this place can't stay open and treat patients. I know that we have one brave soul in the audience that's, and the rest have to stay quiet or they risk their job. But that's what's being said. That's what's being said underneath. And we can no longer not be brave enough to bring it to the surface, because this is a lot of money we're talking about. So let me finish my thought here. What was told to me, and it's now making sense, their predictions, their speculation, and their cynicism is panning out to be a more accurate, that LSU really wants a brand new hospital, and keeping Charity open, even if it's limping along, is just would further hurt their chances of a brand new hospital. They got a brand new hospital before any report was presented to the legislature that I'm aware of. Now, they may have one now, and I will state publicly that if I'm not the only one, I'm one of the only ones in the Senate that voted against spending the surplus money on building a new Charity hospital, not because I don't support LSU having a teaching facility state-of-the-art, but because I was never presented with evidence that that was the appropriate way to go. It was sort of, hey, this is something we want to do, and the Blanco administration said, yes, this is what we want to do, and let's go spend $1 billion. Where is that study, and can we see it before we spend over $1 billion? And also, my experience in construction, if you say something's going to cost 1.2 billion, it's really going to cost 2.2 billion,
Especially in government.
especially in government.
But let me say a couple things. First of all, what I say here as secretary is I know Dr. Lombardi. I've met Dr. Cerise several times and his team. And if I say anything that disagrees with anything that they've said or are doing, it's certainly by no means intended to impugn their integrity. They're good people and want to do the right thing.
We can all have valid differences of opinion.
So I want to say that, and I also want to say that my issue with how we're doing this is, in my opinion, it needs to be a very transparent process. The business case needs to be transparent. If there's an analysis that's out there, it should be public so people can see it. $1 billion, it's more than just a big acquisition. It's not just the $1 billion that you're going to spend on the front end in capital that's going to tie up debt capacity. It's also the ongoing cost of running the institution. And because it's a huge expense, plus you have to operate it. Our dish funds are capped. We're at our cap, so there's not more money out there. And so if you're not sure about the business plan, if the business plan isn't absolutely transparent, if it hasn't been vetted publicly, if it hasn't been in front of a committee like this where people can ask questions of the people who've written the business plan, and everybody's comfortable with it, let me tell you why it's important to go through that process. Even though, Senator, that may slow the process down, it actually helps you get there faster because those are the very same questions that are going to be asked by the lenders. And if your business plan, I'm telling you, a $2.5 million a bed project is going to raise questions in the financial market.
But is this even being asked right now, or are we just going down the path? I guess the end result is, the end question is, are we just, has the general administration made a decision that we are proceeding down with a brand new LSU hospital? Or is there any talk of, hey, wait, let's revisit this and see if we want to do it another way? That's the question.
The general administration has said that we support the new hospital. Okay. That was a decision that was made by the prior administration. We are not going to undo that decision. I will say, that said, if there's an analysis that shows it's more expensive to build a new hospital than to replace an existing one, I still think that data should be out there so everybody knows what they're getting. I mean, I think it's only fair that everybody understand that.
Okay, so but at this point right now, we're building a new hospital, and the question is, and did I miss that part, how big and when?
I believe scope, yes.
You told me a year.
I'm sorry, Senator.
No, that's okay. I think Senator Murray tried to bring me up to speed that you said a year, but okay.
I think you have to have the second part of your question was, what's going on. I think Dr. Cerise and I have been engaged in some dialogue. I think we're going to be going through the business plan together. I actually, in fact, I just told him this morning, my plan would be if he wants to retain the people that have already done the first business plan and go back and do some rework on it, and yet I'll go out and hire somebody to come back behind them and do some vetting of the business plan. I'm happy to do it that way. And we can use, and Commissioner Davis has made it clear she'll free up some of the funds that they have to help with that process. So the money's there, you've appropriated it, so it's okay to use. I think all of us would agree to use it for planning purposes to make sure we have a good business plan. The business plan drives everything. It drives the size, it drives the scope of services.
That process is going to take about a year to finish this business plan?
I would hope that process takes 2 to 3 months.
Okay.
Okay, then we'll know where we're at, and then we can say, all right, we're ready to go forward.
So maybe by the summer, we'll have a business plan, and at that point,
hopefully before we leave the session.
I'm not going to give anybody false timelines, Senator, so I don't want to say by this date it'll be done. You can certainly tell us to expect that.
Not hold you to it.
Yeah, I would hope that, yes. I would hope for that. And I think that we're prepared, I'm prepared to dedicate staff and resources.
Well, Dr. Levine, in all due respect, I think it should be your #1 priority as secretary, in all due respect.